All right. Well, welcome to Breaking the Loop. It's my podcast, and this is my first episode. I'm really excited for this. I've been wanting to do this, and there just hasn't been the time. This podcast is for anyone who has been suffering with headaches, dizziness, jaw pain or TMJ disorder, or neck pain. And by neck pain, that can mean to your shoulders, to your arms, to your shoulder blades, and facial pain. So you may have like ear symptoms, throat tensions, tooth sensitivity, head, neck, and jaw problems. That's what this is for. And this started because over 10 years ago now, I've been practicing for 16 years, but over 10 years ago, I started noticing a trend where people with these symptoms would start telling me, I feel like I'm just like stuck in a loop. It's better, and then it gets worse again. And then I get my hopes up, and it comes back again. And this technique relieves the discomfort, but it never goes away long term. And then one day, one guy, he goes to me, yeah, I just feel like I'm in a loop. And that's when it really started to click for me how the medical world is trying to solve a loop, which is something that's ingrained in us because of different factors, which I'll go into, where the medical system is trying to address that with one-off treatments, targeting specific things, right? It reminds me of like if there was like a river rushing in a big circle, and you tried to break that rushing circle of water by, I don't know, with like a cup and a bucket trying to scoop it out from one area. That's your treatment. Your treatment targeting one thing. It's a big flowing round river and you're trying to scoop out. No, you need to, that doesn't break the loop. That just pulls a little water out. And that's your relief. That's your, it hurts here, so I'm going to do something here. My jaw hurts here, so I'm going to try to relieve it by touching here and doing something here to get it to feel better. You're not stopping that rushing loop of water. And we need to come in at multiple angles, multiple sides of attack, multiple strategies to slow everything down, bring it to a stop. And then we have to reroute the loop because a loop is just something in the way that we function. Think about when you're thriving, maybe in your career or a sport or in your personal life, everything is clicking, right? That's a loop. That's a loop that you're in that is helping you to thrive. Everything is clicking on all levels. But then there's loops that we fall into where they are not optimized for our success. That's when we're really stressed out and we just can't seem to achieve at that sport or in our career. We keep stumbling and we can't gain any momentum. You're also in a loop. It's just a non-productive loop. So our system is always firing in a loop. How do we create loops that allow us to become the best version of ourselves? And for people listening to this, it starts the best version of themselves. To get to the best version of themselves, they need to stop having either pain or discomfort or this distraction of this nagging symptom. That's what breaking the loop is. That's what this podcast is going to be about. And, I got into this. First of all, I got into it by chance because someone came at the PT clinic I was working at. The front desk person came back and said, hey, does anyone here work with TMJ? And the other therapist said, I'm not sticking my hand in anyone's mouth. And I was like, whatever, I'll do it. I don't care. Give me a glove. And that kind of got me into the world. And then before you know, it's like, oh, he treats TMJ, but do you treat ear symptoms? There's ear stuff going on. And also their neck hurts very specifically and they get headaches. And everything started coming in and it started getting complicated. It went from simple. Again, I thought I knew what I was doing, but I was going just the problem. Well, your jaw hurts. Let's just massage it here. Let's give you an exercise for here. And then when I started getting in all these people with different symptoms, my jaw hurts and my neck hurts. Or the other person, my jaw hurts and I'm dizzy. Or the other person, oh no, I'm just dizzy and my ear hurts. I started, again, realizing there was a loop, but I didn't fully understand it until I started getting neck pain and headache that did not go away and motion sickness. And I remember it started and I was like, this can't last more than a week. And then I was like, this cannot last more than a month. And then I was like, there's no way this is going to last 6 months. No, a year, 2 years, 3 years. It kept going on. And that's when I started realizing, okay, sometimes you don't think about things critically until it happens to you. And I know that sounds terrible because that was my job, but it's just a different level. And then I started thinking back to all the things people said to me. I'm like, that's what they meant. Oh, that's how they felt. That's what was going on. And it took that event to really get me fully immersed in this. And that's kind of what led me up to this point. And I just want to touch on 3 fundamental things that we're going to be addressing over time in the podcast, just like I do in my social media, just like I do in my programs, just like I do one-on-one. When we think about this dysfunction, we have to think of it from bottom up, top down, and outside in. Okay? Bottom up is the way your body produces symptoms, from the body up to the brain, because that's what, I don't want to get too technical, but the brain is what actually makes you feel what you feel. So bottom up is when your muscles and your fascia function either properly or improperly. It's movement and stretch. And then there's the joints. Are they too stiff? Are they not working properly? The mobility of the joints. So the muscles and fascia move us in different directions, and the joints allow us to move, between the bones. I'm getting too technical here. And those 2 things together make up your posture. And then it's like, all right, this is the state of my muscle, my fascia, my joints, this is my posture. But now how do I move within that? Can I coordinate movement from my hip to my core, to my arm, to my neck? So we need to figure out what's going on there, where the dysfunction is in there. And when we get that all firing, your bottom up is good. But then there's top down. So your body can only send signals up to the brain. Your body can't give you pain. Your body just says, hey, brain, something's going on down here. I'm going to send the signal up here. You figure it out. And the brain says, oh, that seems like a threat. I'm going to make you feel pain. And that's how you feel pain. Okay? That is normal functioning of the body. But sometimes the brain, your neuroplasticity, stops working properly. And when it stops working properly, it takes a signal from the body that should not be dysfunctional, that should be normal, and it makes you feel pain. So sometimes we feel pain and discomfort in the lack of physical injury because your neuroplasticity broke down. That is top down. So bottom up is your body, top down is your neuroplasticity, and there's 3 ways that the neuroplasticity breaks down. The first is through emotions. So I've been in pain for a while. I'm worried about this. I don't know if this is ever going to get better. I booked that vacation. Am I going to be okay on the vacation? All these emotions, all these frustrations, they light a fire into the nervous system, producing pain. Then there is trust. So if you had a past injury, oh, by the way, with emotions also comes in past traumas and deeper, like embedded subconscious issues, but all that can produce pain. That's emotions. Then there's trust, right? So let's say you turned your head to the right one day and caused an injury. And now that injury is better. Your brain remembers, hey, last time I let this guy turn all the way to the right, as he was approaching, I started giving him a signal, like to feel tightness in his neck, but he kept moving his neck and injured me. So I don't trust him anymore. So what I'm going to do now is I'm going to give him the sensation of that pain and tension as soon as he even begins to turn, because I don't trust him to stop when I want him to. So I'm going to make him fear movement. And that is a lack of trust. And that is when people start saying, oh, I barely move and I have pain. There must be something horrible in my body. But it's really the brain not trusting you. It's giving you a false sense of danger. And then guess what happens? This false sense of danger makes you worried and activates the emotions. So we have our emotions, we have our trust, and then we have awareness. And awareness is simply focusing on it. So if you've ever been shopping for a new car, you went to a dealership, you saw a car you never really thought about buying, you said, I'm going to think about it. I kind of actually like that. And then you drove home. And what happens on that drive home? You see that car everywhere on the road. And did suddenly everyone buy that in the past 10 minutes since you left the dealership? No. It's just now you're tuned into it. You're aware to it. You never paid attention to that car on the road before. That's the same thing with injury. Now I've been feeling some tension when I drove. My neck's behind me. I think my head hurts right there. You wake up in the morning. What happens? Am I in pain? You get up to move, or you sit down, deep breath. Am I in pain? You're on the drive. Am I in pain? Hold on, let me check in on it now. I'm gonna check in on it now. Is it hurting now? Is it gonna hurt tonight when I go to the dinner? Check. And you're driving a signal there of awareness. You're creating a super highway of thoughts. And now you've created so much awareness. No matter what you do, it's always flowing there. One experiment I tell people to do is if you have pain on one side, sit there and think about the other side for 5 minutes. Pause the podcast, think about the opposite side of your body in the same place for 5 minutes. You're going to start picking things up, sensations, pressures, different things you didn't feel before, simply because you're focusing on it. So when the top-down nervous system goes bad, it's because of, remember this, ETA, this is what I use with everyone, emotions, trust, or awareness. Okay, so we have bottom up. Something's going on in our body, our muscles, our fascia, our joint, our posture, our movement patterns. Then we have top down. Something's going on in our emotions, our trust, or our awareness with our nervous system. But then there's outside in. There is, I'm not sitting in the right position, or I don't have the right ergonomics during the day. So outside in is lifestyle. All the forces of the world that come in on your body, whether you do it to yourself or not. So like, what position do you spend your time in? Are you ergonomically set up properly? Do you work on sleeping properly? Do you have the right pillow, the right mattress? Do you have the right habits in the day? Or do you bite your nails? Do you rest on your chin all the time? Do you chew gum too much? Are you stressed all the time? Do you not know how to manage stress? Do you overreact? That kind of trickles into neuroplasticity too. But outside in is not your body, it's not your brain, it's the forces of the world that are having their way with you. And this is so important. It's how we structure everything, because if you do 5 exercises for 6 minutes in the beginning of the day, or 10 minutes, even if you have the perfect workout routine, let's say you have the perfect rehab routine, you do it for 30 minutes in the morning, and then the rest of the 23 and a half hours of the day, you don't even think about anything else. Like, no, I did my routine already, I'm good. The volume, the pure volume of the day is going to crush you. It's going to crush all of your efforts. And so that's why lifestyle is so important. Okay? So bottom up, top down, and outside in. That's the loop. Those are the pieces of the loop. And my job with this podcast is to help teach you which bucket you're in for all of it. Musculoskeletally, which is, again, bottom up. Which bucket are you in? Is it the movement bucket? Is it the joint bucket? Is it the posture bucket? Which one do we need to focus? I mean, it all works together, but there's ones that we're always trying to find the biggest lever. What lever can I pull with you that gives you the biggest breakthrough? We want to work on everything but the big things. And which bucket are you in? Top down, neuroplasticity. What bucket are you in? Is it the emotions that really get you? Is it the trust piece, or is it the awareness? We're going to work on all of them, but like, what's the one we really have to focus on? And lifestyle, which bucket are you in? Are you sitting all day? Is it your position? No. Is it your sleep? Is it your habits, what you do with your body? Is it your stress levels? We're going to work on all of them, but what's the biggest bucket? So the key to all of this, the way that I work with people, the way I talk about it, the way I educate and work with my groups, the way I put together programs. And if you see my social media, you kind of know where I'm going with this. I try to take this complexity, which I hope I didn't overwhelm you there, and break it down into its simplest form. I'm not going to educate and teach you things that are unnecessary just because it's like an interesting new fact. It's like, no, what do we actually need to do? What's the big lever we need to pull, and how do we get you better quicker? Because there's certain laws that I live by when it comes to working with people. And it's, first of all, we got to burn the bridge. You got to be all in on this. It's not like I'll do an exercise today, or maybe I'll try to fix myself. No, we got to be all in, because neuroscience shows that you need to actually be obsessed with something to deliver results. So you don't need to be like this the rest of your life, but let's get you out of this ditch by just going all in. Okay? When you're ready. That doesn't mean you have to do it right now, but when you're ready, we got to go for it. We need to go towards the fear and pain. Something you notice keeps bothering you, guess what? We don't avoid it. We figure out a way to implement in an intelligent way so that you can get past it. The pain is a compass. Let it guide you. This exercise bothers you, this position bothers you. Let's not avoid it. Let's go into it and figure out how to face the fear, face the pain, because it's telling you, here's the problem. Here it is. X marks the spot. Now we got to go towards it and investigate it. Just like when you're starting a new habit, a new routine, even me setting up this podcast today, I was like, oh God, what is this? I need to make a profile picture. I have to make a name, but how do I need mics? Oh, I don't want to do this. I'm going to avoid it. Guess what? X marks the spot. You go towards the pain. It's just like that in life. It's always uncomfortable to figure these things out, but that's where it's at. And it's the same thing with pain. We need to go towards it. Don't go away from the pain. We need to control the variables. We cannot throw in multiple things at a time. We need to Take one thing and add it in. Did it make you feel better, worse, or the same? Got it. With that information, we make the next step and the next step. It's not about everything I do with people, everything that I focus on is about putting in one thing and seeing how you respond, and then the next thing. So it's a very simple process. And do what you love, damn it. That's the last one. You could find these right on my website. Do what you love, damn it. That means we're not going to stop doing what we enjoy. We might pause it for a couple of weeks so we get a handle on what we're doing here, but then we're going to integrate it and figure it out and go for it. There's absolutely no reason. Rarely, I can think on one hand of times that someone does actually have to stop an activity. It's about doing what you love, because what's the point of any of this if you can't actually do what you enjoy? So that is what I want to bring to the table for this podcast. That's the way I want to handle it. You're going to hear me popping in here when I have 5 minutes. I just thought of something, and it's going to be like a 5-minute podcast. And then maybe I'll sit down for an hour also. So let's hope I stick to that. Imagine you just hear this and then you don't see a podcast for 6 months. You're going to be like, man, he was hyped up and then he couldn't follow through on it. So let's hope that doesn't happen. But yeah, breaking the loop, it's all about feeling like yourself again. And there's going to be other wellness things that we can add on top. Like, you're feeling better. Now let's do these, now let's talk about these things that can make you thrive. Again, loops are good, they're bad, and we need to find the loop that you want to be in. So that's all I have for today. Not too bad. First recording, I'm seeing 16 minutes. I think I can make this work on my schedule. I'm excited. Thank you for listening, and I hope you tune in for episode number 2.